Measles alert, potential exposure in local hospitals. Attention all residents of the capital region. There's a measles alert after a patient visited the emergency departments of Saratoga Hospital and Albany Medical Center. This is a serious matter because measles is highly contagious and can lead to severe complications. The New York State Department of Health has issued a warning about potential measles exposure. The patient, who recently traveled internationally, sought medical attention at both hospitals before being diagnosed with measles. While the risk of infection is considered low, it's still important to take precautions. If you were in the emergency room at Saratoga Hospital on July 14, it's recommended that you contact the hospital directly for further instructions. Patients who visited the emergency room at Albany Medical Center on July 16 have already been contacted by the facility. Measles is caused by a virus that spreads through coughing and sneezing. It's a serious respiratory illness that can cause a distinctive rash and high fever. You can catch the disease by inhaling the virus or by touching a surface contaminated with the virus and then touching your face. The Department of Health strongly recommends getting vaccinated against measles, especially if you haven't been previously immunized. The measles, mumps, and rubella (MMR) vaccine is highly effective in preventing the disease. You can find more information about the MMR vaccine here, https://www.cdc.gov/measles/vaccines/index.html. Additionally, the New York State Department of Health issued a travel advisory on April 2. It's advisable for travelers to ensure they are fully vaccinated against measles at least 2 weeks before their trip. You can access the travel advisory here, https://www.health.ny.gov/diseases/communicable/measles/providers/docs/2025-04-02_advisory.pdf. If you're unsure about your vaccination status, don't hesitate to reach out to your local healthcare provider. Staying informed and taking preventive measures can help protect you and your community from this highly contagious disease. But here's where it gets controversial. Some people question the necessity of vaccines, citing concerns about safety and side effects. What do you think? Should vaccines be mandatory for public health reasons? Share your thoughts in the comments below. Measles alert, hospitals in Capital Region on high alert. Imagine walking into a hospital, seeking care, only to later discover you might have been exposed to a highly contagious disease like measles. That's the unsettling reality for some individuals who recently visited 2 Capital Region hospitals in New York. The New York State Department of Health, NYSDOH, has issued a warning about potential measles exposure at Saratoga Hospital and Albany Medical Center, raising concerns about public health and the importance of vaccination. But here's where it gets even more concerning. This comes at a time when the U.S. is grappling with its worst measles outbreak in over 3 decades. And this is the part most people miss. Even a single case of measles can spark a widespread outbreak if the community isn't adequately immunized. The situation unfolded after a Vermont resident, who had recently traveled internationally, sought treatment at both hospital emergency departments. It was later confirmed that this individual had measles. Despite the low risk of infection, the NYSDOH is urging anyone who visited Saratoga Hospital's emergency department on July 14 to contact the hospital. Meanwhile, those potentially exposed at Albany Medical Center's emergency department on July 16 have already been notified directly. But here's the controversial part. While both hospitals acted swiftly to isolate the patient and notify health authorities, the incident highlights the ongoing debate about vaccination rates and the role of international travel in spreading infectious diseases. Should travelers be required to provide proof of vaccination before boarding flights? Or is this an overreach of public health measures? Albany Medical Center's Executive Vice President and Hospital General Director, Dr. Jason Muzaks, assured the public that the hospital followed all protocols, including immediate isolation of the patient and notification of the Department of Health. However, State Health Commissioner Dr. James McDonald emphasized, measles remains a threat to public health, and exposure during travel is something we need to consider. It's crucial that New Yorkers ensure they are immunized against measles. This raises another thought-provoking question. Are we doing enough to educate the public about the importance of vaccines, especially in an era of increasing global connectivity? To prevent further spread, Saratoga Hospital has implemented a mask mandate for all emergency department patients and visitors as part of its infection control plan. Meanwhile, a collaborative effort between Albany Medical Center, Saratoga Hospital, and NYSDOH partners is underway to investigate the case and take preventive actions. But here's where it gets even more complex. While measles outbreaks in Illinois and North Dakota have recently ended, this incident serves as a stark reminder that the threat is far from over. The NYSDOH reiterates that the best protection against measles is the measles, mumps, and rubella (MMR) vaccine. For those planning international travel, vaccination at least 2 weeks before departure is strongly recommended. As we navigate this public health challenge, it's essential to ask ourselves, are we prepared for the next potential outbreak? And what role should individual responsibility play in safeguarding community health? Share your thoughts in the comments. Let's spark a conversation that could shape how we approach infectious diseases in the future.